Hi there. I think that's a pretty broad stroke statement that Black health professionals aren't very objective, that they all apply their personal beliefs to the care, which a lot of beliefs align with the environment that they grew up in. I think that's a perfect example of a bias that maybe you may have based on, I'm not sure if that's been your experience, right? With maybe one, two, or how many ever professionals. But one, that's a bias, but two, I think, just like any profession has good and bad professionals, right? And so you may have good experiences with some, bad experiences with others, but you want to be careful not to apply broad stroke opinions to everybody, especially of a particular race, of not being objective, because I can assure you there's quite a few very skilled, very qualified, very competent, and very objective practitioners. I think any good practitioner is also going to bring their own life experiences, their own trainings, their own job experiences, and things like that. They're always going to be working with things in mind, but those things in mind, but they're not going to necessarily push that on their patient or their clients. They're going to be very collaborative, but they may rely upon lived in experience or work experiences or trainings or educations and things like that, as they should. But it's not going to be a one size fits all to patients, or, you're not going to be my brother or my sister just because we're both Black. While we may share a common culture, we may even share some common experiences. We do recognize the individual differences in our patients and in the care that we give our patients. But, anytime that you have an experience with a practitioner that doesn't align with what you believe, maybe you might want to clarify, ask questions, or even, express to your practitioner your boundaries or how you feel about their treatment, or maybe some of the conclusions and things that they've come to. So those are just my personal thoughts.